minutes past the hour, 95.1 Nigeria Info Talk, station of the nation. Thank you for staying with us. And right now it's time for Budeshiwaka.
Oh, yeah.
Budeshi, of course, is the Hausa word or phrase for open it up. And we're definitely opening up stuff here, looking at contracting and procurement processes. The PPDC is the Public and Private Development Center, and they've been with us for quite a while, looking at the processes, making sure that things are transparent, accountability is ensured. And right now we have some information from KANO State.
Yeah.
Well, with us this morning we have Kachi Chuku and Olise Onwuka and Nena Eze. Good morning, guys.
Morning.
Morning.
All right. So since we started this series, right? You guys have visited Edo, Anambra, Delta, Benue, and now Kano State. And I'm sure you have some cherry reports, Kachi, to give to us. All right. So tell us about Kano. I mean, what are some of your findings?
Okay, well, having been there for the monitoring, so we
Yeah.
decided to have this community engagement, and the turn-up was actually very good. It was awesome. We had a whole lot of stakeholders from the communities. So for Kano, we had both stakeholders from the primary healthcare, from the UBEC, for this particular community town hall meeting, and so we had about 9 communities coming from the UBEC, and the other 6 from the PHCs. That's basically what we had there.
Okay.
Yeah. So
So you're tracking both health
yes,
and
education.
education.
Yes.
So how many communities did you visit there?
14 communities.
14 communities.
14 communities, yes.
Do you want to take them one by one, or you just want to give us a summary of everything?
I think it's a summary because
All right,
they
so-
all had the same problem.
Okay.
Yeah, rolling across. So, first, we think we had the first project we had for the UBEC was the GGSS Gundua and Gezawa local government, Kano. Okay, so it was contracted for this sum of 19,900,000. It was supposed to be a renovation of 3 blocks of 2 classrooms, a block of 2 units of VIP toilets, and a PPU dual desk. So, but when we had the town hall meeting, when the representatives came, they did agree, they did accept that they came for the renovation, but after the renovation, they had no PPU desk. There were no desks. So, as a matter of fact, this particular school, it wasn't actually put in the budget. It has the boys section and the girls section. In the budget, what was budgeted for was the boys section. But when the contractor came, he went on to the girls section to actually do the construction. So the girls were not even budgeted for. So after the construction, they had to go back and do that of the boys. So the head teacher from that of the girls came and said they have over 800 students in the school with only 6 classrooms. And in the 6 classrooms, in each classroom, you're supposed to have 75 students, but what they have is 180 students with only 20 seats. So a station where you have majority of the students coming to school with their own mats and sitting on the floor.
Okay.
So, and to some extent, they had to resort to putting a shade in between 2 classroom blocks and giving them mats to use. And in the school as well, they don't have, it was ordered that they should have VIP toilets. They do not have toilets. They only have 3 pit toilets in the school, which 800 students are making use of. So when she came, she was actually very bitter because they've actually just seen the contract amount for the very first time.
That's the principal now?
The head teacher, yes.
Wow, the head teacher.
Yes. They've actually just seen the
Oh,
contract
so the
amount.
head teacher didn't even know how much it was for?
No.
Most
Most of them don't. They just see it and they heard for the first time and they are so surprised that a contract was awarded for this much. You know, because most of them always have this complaint that they're not informed. Yeah, they're not informed before the renovations take place. They just chill and then sometimes you have the contractor just come in with their workers and start working and all that. So that was our own complaint for this particular school. And then for that of the boys section, it was something similar, although theirs wasn't as bad as that of the girls. And then we also had another school in Jakasa. That is the rehabilitation of Jakasa Special Primary School in Kano State.
Okay.
It was awarded for the sum of 30 million.
30 million.
Yes, it was supposed to be a construction of 4 blocks of 2 classrooms to be renovated and completed. But the complaint really is that the classrooms are never enough. It's just like you have these buildings and then they're just empty. no seats for the students to make use of. So they all resort to either the communities donate mats, or the students are forced to come with mats to use in the classrooms. It's really, really terrible, I must confess.
You said that's a 30 million.
30 million naira, yes.
And what was on
To
ground?
renovate four
Four
blocks.
blocks of
two,
classrooms.
Wow.
And then what was on ground? You know.
The renovation was done. Well, you know, when you talk of renovation, there are various types. You know,
Yeah.
renovation could just be patching and painting, because most of them were complaining that it was renovated, but when you visit the classrooms, their floors are not cemented. They're still you'll be seeing sand on
yeah.
the floor and all that. So, and then you see some of them, they were wanted to have renovations with seats, and they don't have chairs in the classroom. And one major problem I think we were able to notice there was that because the head teachers are not aware of these projects, they don't know what to expect. So at the end of the whole project, they're just giving this completion form and they sign without actually knowing what to expect. These are what you're supposed to ask the contractors for. These are what the components of this particular project. Because you don't know,
So
you
they
just sign.
off
Yes.
on it.
Did you have UBEC officials there at this meeting, or at the state level now? That's the state basic education.
Yeah, we did. The only
SBEB.
we did, but that was from the Almajiri.
Okay.
They were there present. I think theirs actually was a bit better actually. They had most of their complaints were a bit from mattresses to the mats and lack of beds, because theirs is a boarding school. Theirs was it was a bit minimal compared to these other day students from. Those were the only states officials from the SUBEB that were present.
Did you get any feedback from UBEC, because you were actually measuring the performances of the 2015 UBEC intervention projects? Did you get any feedback from UBEC to explain why you have these inconsistencies?
Well, after the monitoring reports were sent to them, we had a few feedbacks from them. Most of them, they actually just complained that most of the time, the reports that they have from their monitors are that these things are functional.
I remember last week a UBEC official was here, Mr. I can't remember his name now, but they promised to come back sometime. You know, based on some of the reports from Anambra, Delta, and the other places that you guys visited, it was posed to him like, these are some of the problems on ground that were noticed. What could actually be the cause of this? And he gave his own explanation, and I'm sure maybe they will still have to come back to the studio, you know. But you know, one basic thing I know we kept on emphasizing is the gap in terms of communication,
gap, yes.
you know, and needs assessment before some of these projects are carried out. I'm sure that was obviously
the same problem.
Very
obvious.
Very obvious.
Yeah, because a situation like I said, where some students are looking for more classrooms, you're giving them desks, and some that don't have desks, you're giving them classrooms. So they don't consult, they don't have meetings with the head teachers, they don't have meetings with the community people as to find out what exactly, what do you lack, what do you need, exactly. So you just sit here in the office and just make these decisions and expect them to be happy about it. As a matter of fact, most of the community people don't even know who these projects are from. You have some of them tell you that the contractors actually, when they tell the contractors that, we don't actually need more classrooms, what we need are desks. The contractors will turn back and tell them, like, are you mad? We're actually doing you favors. They're actually, they're actually doing them. We're actually doing you favors. You're actually doing us favors. That's what they see. So that's usually what the problem is. So there's no communication.
So you say UBEC says that the monitor said that
the
work has been done?
Yes. Because we
and
had this
they just take it like that.
That's exactly the problem. The monitor, the head teacher for this particular GS, the reason why I'm focusing on this particular school was really terrible because she had the most students. 800 students, and they're all females. She had the most students, and they don't have classrooms, they don't have desks, they sit on the floor. So when I asked her why is it that don't they have UBEC monitors visit this school, she said they come once in a while, but they do not do proper inspections, and that she feels they don't do proper reporting as well. Because this problem has been on.
Of course, if you don't do proper inspection, how
can you do proper reporting? And she has written over 17 letters to the UBEC to date, no response.
Now, you said you monitored, like, or you had this meeting with over 14 communities?
Yes.
Now, is it the same story all through, or are there some cherry news in some other
Unfortunately,
cases?
no cherry news.
All of them?
All of them were all horrible.
Wow.
That is
so now that I'm sure you've created this awareness about the need for the head teachers or the principals to be involved in the process. Now, what do you hope to see from now on? You know, because I'm sure there will be subsequent
changes
meetings
again.
like this
Yes.
and monitoring that you're going to carry out? I mean, what is the expectation?
The truth is, the most they can do is actually right. But I think it's until this, the commissions, the UVEC, actually tries to understand that these people are vital. They're vital to the progress and growth of these schools until you start getting them involved. Because the most they can actually do is just right. There's nothing more they can actually do.
Yeah.
Yes. So until UVEC understands that these people are important and they are vital to the progress and development of these schools, they need to involve them. If you actually want to, because I don't know how you expect to help somebody without actually knowing their problems.
Well, let's say you've inquired about this thing. You want to add something to what Kachi has been saying?
Yeah, we had a peculiar case in Farunrua Tasha, a PHC. Their case was so bad that it's just a building, no beds, no chairs, no desks, nothing. It's just empty. And at the point, the man told us that they treat patients with mats. That if you want to come there, you need to come
With
there
your
with your mats. It's that bad, and I think the
Arise,
government
take
really
up your
needs
bed and walk.
exactly. No water, nothing, and in fact, they even have a generator house without a generator.
Wow.
Yes.
And what was some of do you remember the budget?
Yes, it was contracted for 22 million naira.
22 million naira.
Yes.
22
22
million.
For
million
the
naira.
construction of primary health
primary
care
health
center,
care,
yes.
and nothing.
Nothing,
involved to
just a
check for it?
building. Just a building.
No beds, no equipment,
Nothing.
no medications.
Nothing. Not even a drug.
Nothing. It's just empty.
Yes, nothing.
But was it manned by health workers? Because I know that was also one of the issues, that sometimes you do have the PHCs, but they're not manned by any
but
medical staff. But for this one, was it under lock and key? Was it?
this particular one was open, but it wasn't functional.
Yeah.
So, and they didn't have any health staff. But you can't really blame them, actually. When you don't have any equipment in there, what is the health staff coming
What are
to
you
do?
doing?
It's just an empty building.
So where do the people source their medical care from?
So what they do sometimes is community contribution. They contribute and buy drugs and mix drugs however they can. And we even had a situation in one of the PHCs where the officer in charge is not really a health worker, but he's just something he had to start doing on his own. You can imagine they just play trial and error with people's lives and
Can
all
you
that. So
imagine?
it's really bad actually. And then when I get to see the sum that has been used in contracting for these projects, they get so amazed really as to why don't they have these particular things. Most of them were actually hearing for the first time that PHCs of various types.
Now, did you contact the local government authorities? Because I know I think they have a thing or two to do with this. Because I remember when the UBEC official was saying, he said, "Look, it's a chain. You know, it's from the federal, state, and local government." I mean, is there any way the local government comes into the whole scheme of things? And did you try to contact them to make any inquiries as to
Yes.
what ought to have been done?
Yeah, we did write to the local, all the communities, we did write to the local government.
Okay, so what
channel.
response?
Unfortunately, none of them actually showed up. But from the people who are actually from the community, what they're actually saying is that most of these projects, yes, it's been awarded and it's been given to the local governments to carry out. But the problem is they don't ask if the local governments can actually afford to finance and also carry out this project. That's another thing. It's one thing to just, the chain runs down, but the people you're giving these responsibilities to, are they able to handle this particular?
Let me ask. I want to ask two questions.
Okay.
What's next for the PPDC, and what's next for citizens? Because we're having lots of people, apart from the anger and bile that's rising up in everybody that's listening to this. What does the PPDC want Nigerians to do with this information? Of course, I know you know what you want UBEC to do, or the MPHDC,
CDA.
the agency. You know what you want them to do, but what do you want citizens to do, and what's next for you as PPDC?
Okay, well, I think it's high time we all open up our eyes, wake up. We're all accountable.
Stay woke.
Stay woke and actually just get up, because we're all accountable. There is really nothing. We just can't keep. We on our own part, we're just a voice, but if we, the people, actually can't do anything about it, you just sit and you have some people tell you there's nothing they can do about it. They just have to take whatever that comes. So I think it's high time we, the people, understand that we're all accountable. This is for us.
Also, how do you think the citizens can come in, to be more aware of what they ought to do? Because most times you just say, okay, these guys have not done this, like Ofi said, what do they need to know and what they need to do?
All right. over the years they've been in the dark. They don't know what has been happening. They just see projects, they just see contracts being implemented. They don't have details of these contracts. But now that they know, they can ask the right questions, because if these people who are responsible for taking care of you know that you know what you should expect, you know what you should receive, I think they will do the right thing.
And since it's these things are happening in federal constituencies and senatorial districts, I think that's where the pressure people can begin to put from. And yes, you live in Abuja right now and you don't exactly know what's happening, but you can go to the PPDC website, procurementmonitor.org. You can find out exactly what's happening in your local government, in your constituency, and you can begin to put pressure on your federal reps, on your representatives, on your senators, to put pressure on these agencies, whether it's in education, it's in health, it's in any form of infrastructure. Because I think the problem is that we're content with complaining. I'll say, now, wow, 22 million. And so, it stops there.
Exactly.
It's going to happen in the next administration. Yes. It's going to happen 16 years from now. We have been having this experience because our response has been the same. We complain. Yeah. We feel pained, but we don't do anything about it. And anger is a good emotion.
It is.
Because it will spur you to do certain things about it. With that anger, we should be putting pressure on our House of Reps. Say, look, in 2019, don't expect to get voted if you don't do something about this. Just know that you are not returning if you don't do anything. If you decide to rig the election, we'll handle you in a different way. Exactly. But if you are waiting on a popular vote, you're not getting it until you do something about it. And I think that's what we need to understand. And my mantra that I've been pushing, I'll continue to push it, is if we want the dividends of democracy, we must take on the responsibilities of democracy. If I want the dividends of a degree, I have to take on the responsibilities of a student. Exactly. But Nigerians want the dividends without taking on responsibility. You PPDC should go and do that. You guys have done your part in going into these places. Yeah, people can't leave their jobs to go and find out what's happening. But you guys have come back to tell us.
Because if you don't do these things, like I keep on saying, every time nothing will change, and you might think that you're not affected in one way, but trust me, it's a chain. Somehow you're here, but you have a relative, someone who knows someone, and somehow it affects us also. We need to really rise up to our responsibility, and thank you guys for the work you are doing. I mean, Kachi, Chuku, and Budeshiwaka, both program officers at the PPDC, giving us the report on the Budeshiwaka carried out in KANO State, 14 communities, right? 14, and well, that's it.
You guys get
All right. Been talking with friends from the Public and Private Development Center. We've been talking with Kachi, Olise, and you might want to make your own contributions this morning. You want to ask questions about the monitoring process carried out there by Kachi and his colleague, and also maybe something about the home leader. Call us up and ask those questions. Make your comments 0946000951 and 08095974869, 0803-123-0293. Those are the numbers to call, or you can send us a message via WhatsApp portal 080-999-30137. Before they go, well, they'll be here with us for maybe the next 7 minutes or so.
I mean, some of the figures that you guys wheeled out, particularly Olise and Kachi, 19 million naira just to renovate and build desks, 30 million, 22 million, and nothing is working. So out there, what you gonna do about this? Call us 094600-951. Hello.
Hello, good morning.
Good morning.
Morning.
Thank you. My name is Ibrahim. I'm calling from Cuba.
Thanks for calling.
Yeah, thank you. Many thanks for your efforts in electing there for the job you are doing. However, you've been focusing on what is not working, what is not working, what is not working. I said this in a previous edition. You cannot tell me that in the whole 36 states, including the FCT, there is no one, either PhD or you or whatsoever, or at local government level, or educational. Tell us one that is working. Maybe people could emulate. You don't know who is listening. You just don't focus on what is not working, what is not working. We agree that many are dysfunctional. But try I recognize that and identify one that is working. Let's hear about one that is working.
Ibrahim,
Hello.
I'm sure you're aware that they come here and tell us exactly what they saw. They're not manufacturing it. You can go onto their site. I always
No,
ask
I'm
them,
not-
is there any cherry story? So what they
What
have
I'm
seen
saying
is
is-
what they're reporting.
What I'm saying, this is what I'm saying is that it's good to criticize, but on some other hand, it's good to encourage. What I'm saying is that if I'm saying this is not working, this is not working, I should be able to identify what is working. Then others that are not working could learn from them. That's my point exactly. Not that I'm critical, not that I have anything in mind against them. Just get my point. Thank you.
All right. Thank
Okay.
you for your
But
contribution.
I'm sure when you guys have anything good to report to us,
Definitely
so
we will.
you would definitely
Yes,
do
we
that,
can't
right?
we can't go for monitoring and then see some other thing and come and report some other thing. When we see things that are not the way it's supposed to, we can't come and tell you it is the way, because then there won't be any changes whatsoever.
All right. So we have someone else on the line. Hello.
Hello.
Morning. Please switch off your
Good
radio.
morning.
Morning.
Good morning.
Welcome. What's your name, please?
Yeah, my name is Brian Victoria.
Okay.
Thank you for being enlightening. I think most of the states they don't take the people at the local level serious, and that's why I think those things were not properly followed. Even in the federal level, we know what it is. Just a few weeks ago, a National Health Insurance DG told us how people were siphoning money from there. The following week, he was suspended because he was telling the truth. So what I think they should do more is that continue to expose these things to the consciousness of Nigerians and see how, if they are hearing it, maybe by that they will change their way. Thank you.
All right.
All right. Thank you,
Bright.
Bright. Good morning.
Good morning, Ovi.
Welcome.
Yeah, my name is Mike Chindafosi.
All right, Mike. Welcome to Budeshi.
Yeah. I want to thank the guys from PPDC. What they're doing a very laudable job. But the thing is, like what I've been advocating, until we make our officials to patronize these things, they will not do nothing. That is my own what I've been pushing for all this while. Like the money budgeted for all these PHCs and all these UPEC or SUPEC projects and they're abandoned. It's because they don't have a stake there. Their children are not there. Until we make them patronize them, and like we said, one of the responsibilities as citizens is to say, okay, if your children are not in those places, we're not going to vote to the next election. That is what some of us are saying. Until we do that, nothing will happen. Excuse me, Swat.
Mike.
Yeah, sorry. Our appointment for today, I won't be able to make it because something came up. Please, I want us to schedule up. We tried to send an email, but my internet is down.
No problem.
Please.
Let's talk via the email. Thank you.
Sorry, please. Okay.
Oh, okay, no
So
problem.
that's my contribution.
All right, thank you.
All right. We have to round things off right now. Your final thoughts. And Kachi, what do you say?
Well,
So bad news.
I must sincerely say it's not our fault. It's not that we are happy reporting the bad news. It's just what is on ground, actually.
Exactly.
Okay, so I'll end up by saying that is until we understand that, until we learn and understand that when we develop the public schools and public education, that is a major way to eradicate poverty in Nigeria. I think that's how we'll end up my session.
All right. I'd like to say that the government should make sure they carry out proper needs assessment before starting any project
In any community.
in any
It's
community.
very, very important. The essence and importance of communication and understanding what people need and also giving them that is just very vital in all of this. But thank you guys for coming over. I'm sure next week will be another great time on the Budeshiwaka series. I don't know where you guys are heading to, but let's keep our fingers crossed on that. I'm sure they'll give us some reports next week. Thank you once again for coming over.
Thank you.
And then we will continue with Morning Crossfire in a bit. Stay with us.